mentioned this about diet and exercise. His question is that with the technology already there, and people moving into more, people are, using more cyberspace than the actual, the lifestyle has changed. So how to make aging more healthy when the technology in vision is there?
Okay, well, I'm not a technology specialist. I think that technology can be harnessed. Like telehealth is one big area, and we've certainly seen the emergence of this during the pandemic, and certainly telehealth can be used for, health coaching, appointments with doctors and other healthcare providers. So does that answer the question?
Anyone else? All the other panelists, if anybody
I think what he's saying is because of this technological development, people don't even want to go and turn on their TV. They don't want to do anything. They want to sit on a chair and do everything from there and all that. So, that's also having a very bad effect on health. But that's not only for the elderly. Even the younger ones are doing it. They're just spoiling their health because of that. So that's technology actually is not helping them to have a healthy lifestyle. It is helping them to develop problems, some health issues, So that's a, altogether different issue. But with the elderly people, I think sometimes it helps, because they can't move so easily. They need help all the time. But technology is keeping them connected, integrated. They're connected with the families and so it is really helping them to be with their needs and, like their relatives. So there is a good aspect of technology and there is a bad one too. Yeah, they're both aspects of technological developments.
Yes, Robin?
Yeah, can I also say too that, I certainly realize that about the technology, but nothing is a substitute for, adopting, eating, a healthy diet and getting out there and moving. And there is so much research showing the profound impact that diet and exercise have. That diet and exercise, healthy diet, healthy exercise engaged in regularly can actually help delay or prevent a lot of chronic disease, frailty, and functional and cognitive impairment. So it's just so critical. The research is just so clear. So I think we really need to have not only health education, we need health coaching. And there's a really strong trend or drive with health coaching in the US to help people not just learn about their risk factors for disease, but to actually modify those risk factors in a healthier direction.
Yeah, thank you very much. And yes, as we earlier said, one of the panelists, and we hear this thing, and that younger people should also be made aware of the hazards of using, technology more and not moving around. But then there should be a sort of a combination and a collaboration between the younger generation and the older one, and together they can move forward, working in the same direction for their health goals. So over to the next question, please. Over
Hello.
to you.
My name is Sajjad. I'm from HelpAge International. My question is with Dr. Nader Sayed. So as you mentioned that we lack infrastructure like in our health systems. Our health system is more inclined to cure than prevention. So what would you suggest at primary health care which can support healthy aging?
So like was mentioned, so it is much harder to fix things which are broken than to prevent them from breaking. So the whole idea of primary health care is that you target the mother even before she is pregnant to make sure she has a good hemoglobin, good vitamin levels, so that those 9 months that the baby spends inside the womb actually determine the risk of diabetes 50 years down the road. And this is what Amreen was talking about when she was talking about early childhood care and development. And then there is vaccination, there's clean water. The big increase in life expectancy didn't come with fancy MRIs and surgical techniques. It came with clean water. So we are operating at a level that we still need to address. Primary healthcare, clean water, vaccination, and then preventive examples of preventive measures for the aging would be preventing these very preventable diseases like cancer. Every third man is smoking in this country, right? So that's the problem. Diabetes and blood pressure are not diagnosed, untreated. What does that do? Heart disease, strokes, dementia. So I think your point is exactly valid, that we have to look at it at different levels of the life, come at it from different levels. And I think this is the task for government, yes, but I think the government is preoccupied, under-resourced. The private sector, the NGOs also have the will and the ability to deliver on some of these interventions. And I think that is how we need to proceed, to partnership, etc.
Okay, thank you. Next question.
Something in this,
Yeah,
like
please.
think about a baby who has had several episodes of diarrhea. So, starting life with contaminated water, contaminated food, contaminated air, you're giving such a start to the life. So you can imagine how this baby is going to grow and stunted, the stunted growth that is very common in Pakistan. 40% of people, there's thousands of people, children are stunted. So the start of life, aging starts right from the date birth. Like he said, in the womb, the life starts, So those 9 months, what the mother is having, and then after that, what kind of water and, food, etc. That also decides how you are aging, whether it's healthy aging or it is, aging with difficulties and problems.
Okay, sir. Is it on?
Hello.
Yeah.
I have a few questions, but I will ask only a couple of questions over here. If Dr. Robin can answer these. What could be the most effective ways to promote this awareness about the aging, that people should care about the aging people? My number two is that if we want to engage elderly people, like how many hours we should engage them in a day or in a week? Thank you.
Okay, in terms of promoting awareness of aging, I think that can be done at local and at national levels, in terms of media campaigns and education, gerontology programs, aging education programs, health and aging programs. And then to your second question, I'm sorry, what was your second question, again?
How many hours should we engage them in some sort of activity, the elderly people?
Okay, I don't think there's a set number of hours, and I think that will vary from person to person. And I think, an older adult needs to decide for themselves how many hours they want to be engaged in the community. Like I said, there's no set number, of hours for an older person, as there is not for, a younger person. That, older adults are so different from each other. Like I said, they are not a monolithic group. So in fact, older people tend to become more dissimilar from each other than similar as they get older. We know that. So I think that's really up to the individual, and their health, their, functional capacity, and what they want to do.
Okay, thank you very much. Next question, please.
My question is, how can medicine and supplies related to the elderly be made less costly? Is there any subsidy model in place anywhere globally?
Okay, the question to the international speaker panelist is that over here in Pakistan, the medicine and the equipment related to elderly care is very expensive. Are there any models outside where this can be less costly and made available to the general public, the elderly? Are there any models there? Is there any way this can be taken care of? Joanne, if you can add, your mic is mute.
Yes, yes. Oh, okay. Can you hear me now?
Yes, please.
I was asking Diane if she wanted to take that one because she had several examples from different countries, other than the US that you know, also, and the UK that it has a healthcare system for those who are in need. Dee, do you have any?
I don't have anything at the top of my mind. I just think there should be a collaboration between the private sector and the public sector, and a push from the NGOs and government to try to get the lower prices, and maybe part of the manufacturing in the country.
Okay. So that brings us to what Dr. Nader has shared, that so much of our healthcare is already in the hands of the private sector. So we need to focus more, we need to engage them more into this, and there should be advocacy and a role that can be played by NGOs like TAF and other NGOs and academia as well. And maybe we can bridge a gap there. So next question, if there is any, this will be the last question, please.
Hello, this is Saira Nizam from TAF Foundation. I look after business development here. So my question is that are there any networks or organizations whom we should contact, whom we can collaborate with for this decade, for our activities, for our actions? Thank you.
One such center is the one that is being, headed by Diane over here. But then let's ask Joanne if you can add.
Yes, there are many networks depending on what your focus is. Dee, do you want to add? Dee?
Yes.
Yes, they're asking about networks for different kinds of business activities that might help engage and leverage some of the activities around healthy aging.
Off the top of my head, I can't really give you one that would relate culturally as well, but we can get back. The other thing I would say, there is a couple of examples they may want to look at, and one is a Village of Happiness in Kobe, Japan. And Japan has dealt with the aging issue for a very long time, as we all know. So I would suggest that that may be one of the examples of the integration of all of the things we've been talking about in a positive way.
That's very good. Thank you, Dan. And we'll look forward to, knowing more about all these collaborations, especially the Japanese examples that you have cited in your viewpoint.
Yeah, I wanted to ask from Robin, like in Pakistan, there are not a lot of research going on about aging or aged people. We don't have an institute of aging like we have one of the big institutes at NIH, National Institutes of Health in Bethesda. So I'm just wondering, University of Maryland, I'm a graduate of University of Maryland. So I would like to really have a collaborative joint program with the Department of Gerontology, if you could be available to us, and especially from my university, Women University, Sawabi. We would like to develop this kind of program with University of Maryland. Is it possible to be in touch and join hands to have research projects oriented towards the aging process in Pakistan and then compare it to the US, that'll be a nice joint research project. Can you help us? To university collaboration.
Unmute your mic, please. Robin, your mic is muted.
Yes, there is that possibility, and we would love to explore that. So yes.
Okay, that's lovely. That's one of the initiatives that TAF was already looking forward to, have. That is collaboration between academia and the industry.